It's the first time since the pandemic has begun that all of South Africa's provinces find themselves out of a COVID-19 wave. Those are the statistics coming through from experts reporting through today. 648 new COVID-19 infections reported over the last 24 hours, showing a 2.9% positivity rate, a steady decline, I believe, is what we can call it now. And people, of course, now looking at other ways that South Africa can open up and get to some kind of normalcy after more than a year and a half of living under some kind of lockdown. There's still some kind of uncertainty as to whether fans will be allowed in the F&B Stadium for the Bafana match this coming week. These are the things people are talking about now. And as it stands, only 2,000 people are allowed to attend outdoor events under level 1 lockdown regulations announced by the president just a few short weeks ago. New infections, as we've just said, are down. Currently, over 9.5 million South Africans are fully vaccinated, and this equates to around 24% of the adult population. Professor Barry Schoub is a virologist, and he is also the chairperson of the Ministerial Advisory Committee on COVID-19 vaccines, and he joins us virtually from here in Johannesburg. Barry, as always, thank you so much for your time. A little bit more positive news, on a more positive note we can speak to you about, in as much as unfortunately we are still losing people to this dreaded virus every single day. Where are you standing at as head of COVID, the head advisor and chairperson of that committee on COVID vaccines? Are we getting enough jabs in arms to make us perhaps hope that come December we can reach those targets and have a festive season that will be good for the economy and indeed just for our spirits as well?
Yes, good evening, Marcelle, and thanks for having me. Yes, I think we certainly are facing a major challenge. It is quite a steep challenge that we have to get to try and get at least 70% of the adult population vaccinated. It's, as the state president mentioned a few days ago, that really translates to about 250,000 injections, vaccinations per day. That's quite a tall order. You know, at the moment we're kind of getting to about 200,000 per day. So we really have to kind of up our game. But I hope we will get to that target. But it will really need quite a strong effort to do so.
You speak about hope, which I think we could all do with a large doses of it. I think if we could give doses of that along with the COVID-19 vaccine, we'd all be in a much better space as well.
Yeah.
But we can't just do this on hope. What is the advice that you're hearing, or the information that you're hearing from your colleagues on that advisory committee, and the advice that you are as a whole giving the president about how we're going to reach that number? I believe the president wants 40 million South Africans vaccinated by December. The statistics at the moment are saying that we've got over 60% of the 60-plus age group who have one jab. The same goes for just over 50% of those between 50 and 59 years old. Just last week, Gauteng was reporting that they worried that I think it was something like 1 million people haven't come back for their second jab. These are all just the different challenges going in different directions. One piece of advice to the president from your committee going into this week, with your focus on COVID vaccines, what is it?
Yeah, Marcel, you know, if you look at who's not being vaccinated, there's really three groups. It's the one group who are just simply apathetic. They kind of, they've been in this COVID pandemic now, as you said, for going on, 18 months, and people are tired and they kind of feel, well, they couldn't be bothered to go and get vaccinated. And the apathetic group is really a group who I think we really need to reach out to by making the vaccination readily acceptable to them, readily easily available to them, and also to try and incentivize people to get vaccinated. There's a second group, which may be the largest group of all, and that's people who are nervous, who are kind of worried, who are anxious, they're worried about side effects. And there we need to communicate the message. We need to have what we call trusted communicators, people that go into the community, are trusted by the community, and give the message that these vaccines are shown by sophisticated science to be safe as well as being effective. And, you know, it's all very well us as professionals saying that, but it really needs people in the community to kind of communicate that message. You have a very much smaller group that may be very vocal, of what we call the anti-vaxxers, and
Yeah.
they are, I guess, the kind of activists. I'm not sure that we're really going to kind of make much difference in that group. Again, it might well be education, but very often they're a rather kind of refractory group. But I think we really need to focus our attention on two other groups, the apathetic group and the hesitant group. And there we certainly can make headway, and we do need to make headway in both of those groups.
That's such an important point that you've made. Let's look at incentives now. I mean, South Africans are, as you know, a very proud and excitable sporting nation. And people were one of the few things, or people speak about wanting to get back to, obviously being able to see their families was the first thing. Then it was to go to church. And then the other one is, when can we go back to stadiums to watch our sports teams perform? I'm one of them. In terms of incentives, should we be looking at making access to stadiums an incentive for those getting their jabs? Should that be an incentive? And should sports federations and sports teams be allowed to ventilate plans under which they could allow certain percentage of fans inside stadiums and sports arenas?
Yeah, Marcelle, I think that's a very important point. You know, should vaccine or vaccination certification be a requirement for entry into, say, for example, as you say, sports stadiums and similar kind of functions and venues? And really, certainly that would be good public health practice. We know that vaccinations very markedly, very significantly reduce transmission as well as protecting somebody. And where you have people in large crowds getting together, fairly close level, albeit outdoors, which obviously is a very much better situation than indoors, but nevertheless, still close together, very often getting very excited and loud voice generating these infectious droplets. Sometimes the mask drops below the nose, or even sometimes below the mouth. And yeah, I would think it would be very good public health practice to make it a requirement to be vaccinated to attend these kind of functions, like, as you say, the sporting functions.
Are you giving that kind of advice at this Ministerial Advisory Committee level? And what do you think you could learn from those internationally? I mean, we've been watching green with envy as sports fans have been able to go into these arenas in Europe. Obviously, in Australasia, they've had their own situation for a long time as well, in the Americas as well. Do we learn anything from them in trying to open up this part of a very important part of South Africa's lives?
Yeah, Marcelle, I must mention that these are really my personal opinions rather than the opinions of the MAC. So they are my own personal opinions. And yes, we do learn a lot from what's happening overseas. We learn a lot from what they're instituting, and also how successful what they're instituting is. Successful in terms that, is it acceptable by the population? Do the population who are affected, the people who are affected, do they buy into it? And then does it have the desirable effect? So yeah, we very certainly closely watch what's going on abroad.
Okay, we're going to leave it there. Thank you so much for your time, as always. That's Professor Barry Schoub, virology expert, of course, and he is chairperson of the Ministerial Advisory Committee on COVID-19 vaccines. I just downloaded my digital vaccine certificate, and I'm just dying for places to ask me to show it so that I can gain entry along with other vaccinated South Africans. I went to the movie house for the first time in 2 years today, and nobody asked me for my vaccine card, unfortunately. I'll keep trying.